Welcome back. October marks the start of National Depression and Mental Health Screening Month. Here to discuss a new initiative aimed to reduce depression and anxiety amongst Bronx caregivers is Dr. Amanda Zayde of the Montefiore Health System. Doctor, thank you so much for joining us.
Thank you so much for having me. I'm thrilled to be here.
So, I just want to start off by saying, although people focus on physical health when discussing COVID, the pandemic has also affected the mental health of many, putting multiple stressors on caregivers and parents. The American Psychological Association found that 75% of parents say they could have used more emotional support, while 24% have been diagnosed with a mental health condition. Were you at all shocked by these numbers, and what does this mean long term for families?
Yeah, I don't find it so shocking given the incredible stress that many families have been under just during the course of the pandemic. The pandemic has led to increased social isolation, and people really have had so many worries about their physical health and financial concerns, and all of those things can put people at higher risk for mental health concerns. I think it's one of the reasons that it's so important for us to keep an eye out for our loved ones during this time. And if we see them really struggling, make sure to connect them with a mental health provider, healthcare worker, because that's what we're here for.
And how do you think this will affect families long term?
I think we're still looking into the research in terms of COVID-19. I think it's been a really challenging time, but I think, the parent-child relationship is one of the most important protectors for children, both during and after adversity. And that's why it's so important that we sort of support parents during this time and provide help for families.
Now, how do you think COVID has changed the way we talk about mental health in our communities?
One of the things that, first of all, I do want to say that the pandemic has really disproportionately impacted our Bronx community and made it challenging for so many. One of the positive things that I think has changed is the landscape of the provision of mental health care. And so telehealth, right, is just so much more widely available than it has been in the past, really kind of increasing access to care and treatment engagement and reducing barriers such as transportation.
Now, the National Institute of Health has awarded researchers at Montefiore and Albert Einstein College of Medicine a 5-year, $4.1 million grant to work with Bronx caregivers and healthcare workers. First, I want to say congratulations, and then can you tell us more about this study?
Yes, thank you so much. We are thrilled and so excited to be able to support caregivers during this time. As I mentioned earlier, the parent-child relationship can serve as such a buffer for any of the negative impacts of COVID-19 on children. And so important to us to reach out to the community. And this study will really allow us to provide support for parents of children who have psychiatric conditions, parents of children with autoimmune conditions, and also parents who are healthcare workers over the course of the next 5 years.
I'm so happy that you mentioned that because I was going to ask, what would a high stress parent look like? But I guess now I can ask, what are some ways that we can also support these high stress parents?
Yeah, I'm glad you asked that question. I mean, I think it's important to say that parenting is difficult to begin with for everybody, right? It has its ups and downs and it can be really challenging. And the pandemic created just additional stressors for families. We've seen so many parents kind of attempting to balance work or worries around, not having work, so financial concerns, helping children with things like remote learning, which was extraordinarily challenging for all of us over the last 2 years. Again, and I can't stress this enough, all while feeling really socially isolated, right? There was a big portion of time there where we couldn't even hug our friends and families. And so, I think I would want to say if parents find themselves feeling overwhelmed, feeling like they're having a really hard time just managing the intense emotions that can happen, or even having a hard time getting along with friends and families, reach out to us, right? That's what mental health care workers are here for. And we all could use a little bit of help sometimes. There's no shame in asking for support, that's for sure.
So I want to talk about the study a little bit closely. I understand that your team will look at three different approaches: group therapy, parental education, and then there's going to be a combined approach. Can you explain what that will look like?
I'd be happy to. That's exactly right. So the caregivers are going to be split randomly into 3 different treatment approaches, just as you said. In one approach, we're going to have a care management app, and that's going to allow parents to do things like book appointments and to be in touch with their care management team. And we have customized parent education materials developed by our team, and it's going to cover everything from, just overall management of stress to parenting challenges. And then the next treatment approach will be the care group therapy. It's going to be meeting virtually once a week. And it's really sort of just to bring parents or primary caregivers together in a very non-judgmental space to build a community, right? And they're going to be parents who help each other sort of navigate stressful parenting moments, to share resources, and everybody leaves learning something about themselves and their relationship with their child. And then the third, as you said, will be a combination of these 2 treatment approaches. And the study is really going to give us an opportunity to support parents in multiple ways, and just to learn a little bit more about how we can best support parents in our community during times of adversity.
Now, I'd really like to know, like, what are you hoping will come from this, or what do you hope to see?
Goodness. Well, we are hoping to see, I think, parents feel less alone in their parenting experience. I think many times parents feel like they're the only one. They're the only one really struggling. Oftentimes parents can really beat themselves up and feel like they're a bad parent, right? I'm hoping they feel less alone. I'm hoping that within the context of them feeling less alone, this will serve to strengthen their relationship with their child. And, I'm hoping that a sense of community will help buffer the sort of isolation that many of these parents have felt over the course of the past couple of years.
Now, I feel like you're also taking somewhat of a modern approach because patients will use technology, while you're doing this study. Why did you want to include that element?
Yeah, I think the simplest answer is we wanted to include technology to increase access to care for our community, which I think is especially important during this time, right? And our digital care app will not only provide a means of communication with the care team, but it's also going to coordinate connections to other healthcare providers for the caregivers and parents.
So, mental health is oftentimes a difficult conversation to have, and I understand that it can sometimes be harder for communities of color. Why do you think people have a hard time with this?
I want to start by saying I'm so glad that you're asking this question. I think it's so important that we talk about it. And I would say that on a community level, I think that it's imperative that we acknowledge the existence of institutional racism and the fact that, communities of color have been historically mistreated and abused. And I think naturally that impacts trust in systems of care. And it's something that we have to be always sort of holding in mind. On a personal level, I have seen that when people share something painful or challenging, which can be hard to do, and they then feel that they're not being heard or understood, or that their thoughts and feelings aren't valued, it can lead to this conditioned response, right, where it just feels less and less safe to open up and share. And so I think it's important to note that there can be so much pressure to say exactly the right thing, right? When someone comes to you with something painful, you want to get it just right. I have felt that before. But the reality is, if you can just sort of be curious about their experience and listen and really be present with them, that in and of itself can be enough to help somebody feel really just less alone in their experience.
And how does this work build upon some of the work that you've already done with this community in the past?
Yes. So I developed care about 7 years ago, and our aim really was to bring together parents of children who are struggling with similar challenges. And again, I'll keep saying this just to sort of build a community, because I think parenting can feel isolating at times, especially when you feel you're the only one having this experience. We wanted to create a space where parents could talk about the emotional experience of parenting and encourage one another through these stressful moments. And of course, really strengthen their relationship with their child, right? Bring the joy into caregiving and parenting.
And I quickly want to go over just some misconceptions there can be about, mental health services and what's available to certain communities. Do you feel that do you feel that there may be a misconception that mental health services aren't available to everyone?
One of the reasons that I really was excited to do this interview, despite being nervous about it, was to let everybody know that, Montefiore is here and we offer services for all ages and all stages of life. We serve people with all different kinds of mental health needs in offices throughout the Bronx. So we're here and we'd love to see you and meet you and offer support.
And what can people now do to just improve their mental health at home?
Ooh, okay. So I personally think one of the most important things we can all do, myself included, to support our mental health is a little bit more self-compassion. And one way to do this is in moments where you feel just like super overwhelmed or stressed out or pissed off or whatever it is, to take what I like to call just like a sacred pause. It can be, 10 seconds to just sort of pause and notice what you're thinking and notice what feelings are coming up. There may be more than one, and breathe. And I like to ask myself, what would I say to a loved one if they were going through something really similar? And the reason I ask myself this is because I find that we're often so much kinder, right, to our friends and our family than we are to ourselves, than we are in the way that we speak to ourselves. And so one thing that I hold in mind, and maybe this will be helpful for others, is a saying I really love, and it is, if your compassion does not include yourself, it is incomplete. And so I think that is what I would most highly recommend during this time.
Well, that was amazing. Thank you so much. Can you just let everybody know quickly where they can get in touch?
Yes, absolutely. So you can send us an email at parentsupportstudy@montefiore.org or give us a call, 929-429-5644. We are waiting to hear from you. Come and join our community.
All right, doctor, thank you so much for joining us.
Thank you so much for having me.
We'll be right back with more Open BXRX Tuesday.